I last testified before this committee less than 2 months ago. Since that time, the dedicated professionals at CDC have been working diligently to provide additional resources to states, localities, territories, and tribes, thanks to support from Congress. We are updating our guidance based on the latest scientific evidence, and we are working with our partners around the country and around the globe to reduce the burden of COVID-19. I am pleased to report that since January, we have seen a consistent downward trend with daily averages of new infections dropping 76%, hospitalizations down 71%, and reported deaths decreasing by 75%. This progress is also reflected in our data on the county level risk. Just a few months ago, 85% of all counties in the U.S. were experiencing high COVID-19 transmission rates and increased community risk. This morning, that is down to 33% of counties. These trends give me hope. And still, I continue to emphasize that we must remain diligent and committed to our surveillance and prevention efforts because the emergence of variants could set us back. With your help, CDC is using the $1.7 billion Congress provided to expand nationwide genomic sequencing efforts. Since January, we have dramatically increased sequence output from 3,000 samples per week to approximately 35,000 samples per week. We are also keeping our commitment to prioritize health equity. Since March, we have announced a number of investments that center in health equity. These include $2.25 billion to address COVID-19 related health disparities and advance health equity among high-risk and underserved populations. $3 billion to strengthen vaccine confidence with a focus on increasing uptake and equity in administration, particularly in communities hardest hit by the pandemic. $332 million in community health workers to support COVID-19 prevention and control, and $250 million to develop targeted strategies for vaccine education and outreach for uptake in specific communities. In addition, CDC continues to update our guidance as we learn more. This includes a recent update outlining levels of risk of activities for fully vaccinated and unvaccinated people. We will continue to update this guidance to be clear that vaccines are a means of returning to activities we stopped as a result of the pandemic. I am so proud to report the administration of more than 261 million vaccine doses, including more than 133 million since I last testified before you in March. Over 84% of Americans age 65 and older, and over 58% of all adult Americans have now received at least one vaccine dose. With these cases trending down in the United States and more people getting vaccinated, we are cautiously optimistic. However, globally, the pandemic is more severe than ever. India's surge of cases is tragic and a reminder that the virus can rapidly outstrip our efforts to contain it if we are not careful. We will not end this pandemic without working hand in hand with countries around the globe to fight COVID-19. I want to take a moment to acknowledge that while we have made great progress over the last few months, more than 579,000 people in the United States have died from COVID-19 during this pandemic. And just since I saw you in March, over 39,000 of our loved ones have died from COVID-19 in the United States. Every death is a stark reminder of why we must remain vigilant and focused to end this pandemic as quickly as possible. I want to close with a promise and an appeal to the American people. My promise is that CDC will continue to follow the science as our guide. And my appeal is to implore everyone to get a COVID-19 vaccine as soon as possible as the fastest way to end this pandemic. But even with this powerful tool, while we continue to have community transmission, we must also maintain public health measures we know will prevent the spread of this virus: mask, hygiene, hand hygiene, and physical distancing. Finally, as we get through this pandemic, we must work together over the months and years ahead to build on the investments, partnerships, and innovations that we have created during this crisis. This includes achieving sustainable investments in public health infrastructure to be better prepared for whatever comes next. It is one way we can turn tragedy into lasting progress and improved health for all.